Now, hi, welcome. I'm Siobhan Purdue of PurdueArtTherapy.com, and I am a art therapist and a creative life engagement consultant. And it is my series of live Tuesdays, so I am glad you are here with me. Today we are going to talk about dementia and hallucinations. So this is a topic that I see come up quite a bit in forums and clients and different things. Because sometimes folks with a different type of diagnosis of dementia, Alzheimer's, Lewy bodies, whatnot, can have symptoms, including hallucinations. So we are going to talk about why they show up, what they are, and what you can do about it. As always, if you have a comment or a question, please put it in the chat. If you're watching the replay, welcome, and you can also put it in the chat or email me. I'll give that information in a minute. About any other topics or any questions you have specifically about what we're talking about today. So I'm glad you're here. So what are hallucinations, right? Sorry, I got my notes. So if I look down, that's what I'm looking at. And I want to make sure I get it all, right? So hallucinations are basically the brain misfiring, right? And giving us false perceptions that can show up as visual, olfactory, right? You smell. So what we see, we smell, and we hear. Sometimes even feel, right? So sometimes we can get sensations on our body that we think are real, but it's really our brain misfiring. And so this can happen for a number of reasons, but specifically with someone with Alzheimer's, because the changes in the brain that are going on, it can make the brain misfire and create these sensations that are not actually there. Now, there are some other reasons that hallucinations might show up, whether you have Alzheimer's or dementia or not, and that's important to keep in mind. And it's always important to keep in mind as well if your loved one with a type of dementia or Alzheimer's has hallucinations, also to check into, do they have a history of any sort of mental health issues, mental illness, right? Because if they are comorbid, they have together, right? Someone who has depression and Alzheimer's, schizophrenia and Alzheimer's, bipolar disorder, right? That's going to impact it as well and how things show up. So it's really important to know your loved one, to give your medical professionals a full background so that they can see the whole picture. All right, but so some other reasons in folks that have Alzheimer's and other types of dementia, and then Alzheimer's, sorry, my thing popped up and now my brain's going everywhere. I got lost, right? So again, dementia is not the only reason hallucinations can show up. And so some of the reasons they might show up is schizophrenia, right? If they have a history of schizophrenia, they might already have a history of having hallucinations. And so you might already have an idea of how to treat them, or they might be on medications that can help. That's important to keep in mind. They might still show up even after the diagnosis of dementia, or they might change and alter from what they were before they had it. Physical problems are a big one in older adults, right? So kidney problems, bladder infections, UTI is a huge one for any of you folks who have worked in long-term care before or with older adults. UTIs can throw those folks for a loop, and things can start happening that you have no clue, right? That you would never even guess came from a UTI. It really messes with their chemical balance in their body. So that's a big one that's tested for usually, initially, as one to rule out. Dehydration is a huge one that can throw people loopy. Intense pain or alcohol or drug abuse those can all cause hallucinations in this population. So that's important to know. Eyesight and hearing problems, and we'll go into that a little bit more, can create hallucinations. And then also a bad reaction to medication can have it as well. So that's, again, important to keep in mind and to rule out if this comes up, especially if these symptoms come up and they've never shown up before. It's just suddenly mom seeing things across the room that were not there before, right? So it's important to, if these start happening, right, what do you do? Well, it's important that you call or you talk to your medical provider, right? The primary care doctor about it and rule out any underlying medical issues that are happening. And it's also important to realize that this isn't going to necessarily be fixed by medication. So medication is not actually the first line of defense for this type of thing. It's behavioral, right? To see, and we'll go into that in a second, to see what can be altered in the environment, because medications might just complicate the situation and confuse what's actually going on. So you're not really actually treating the problem. You're just band-aiding it or covering it up and not getting the underlying issue. So that's important to know. So what do you do if your loved one suddenly develops hallucinations, right? Grandma's talking about snakes or someone's crawling through the window. What do you even do, right? And that's upsetting, right? It can be really disconcerting for your loved one to suddenly start talking about these things and you don't understand what they're talking about because you are not experiencing what they're experiencing, right? So it's important to determine what's the underlying feeling of this, right? Where is this kind of coming from? Is the hallucination upsetting? Is it comforting, right? Maybe they see their grandmother who's passed and it's actually a really comforting experience. Perfect, great, let them go with it, right? If it's upsetting, that we don't want, and so then we're going to address it, right? And so oftentimes you want to be a calming presence. You don't want to challenge them initially. For those of you who are caregivers or have worked with older adults with dementia, arguing almost never works. And folks can get really stubborn, and none of us like to be wrong, right? Dementia or not, none of us like to be told we're wrong. And so we will dig our heels in and hold on to our stance, right? So it's important to address the underlying emotion that's coming up with the hallucination, right? Are they afraid? Are they worried? Like I said, maybe it's a positive experience. You want to address that and speak to their emotions versus speak to what they're actually seeing or experiencing, right? And you can say things like, don't worry, I'm here, you're safe, I'll take care of it, that type of thing, right? To kind of reassure them and create that sense of safety that is so important. You might want to gently distract the person from what's going on. Putting your hand, tapping their hand, gently drawing their attention away. Again, you don't want to invalidate their experience and what they're feeling, because this is very real to them. And they're not going to understand if you tell them that they're not seeing what they think they're seeing. That's not going to make sense. That's not going to help anybody in the situation, right? And like I said, acknowledge the feelings behind it. So you might say something like, it sounds like you're really worried about this, right? This is really worrying you. Or something like, this seems like you're really frightened. This is really frightening you, isn't it? Right? Again, and that kind of gets them talking and reassures them, and you can then redirect it, or you can figure out the situation. You might try and distract the person by taking them out of the environment, putting music on, engaging other senses, right? And going back to, you never want to fully disregard their experience and what's going on. So if your loved one sees a person who's not there, right, or you can't see, let's say, you want to be honest, right? So if the person says, well, don't you see him? You can say, well, no, I'm not experiencing what you're experiencing. I don't see it, right? You're not saying that their experience isn't true. You're just admitting, no, I'm not experiencing the same thing right now, right? And you can go on to other specifics or other, interactions, distractions from there. A huge thing to try that can be helpful for somebody is modifying the environment, right? What do you actually have control over that you can change? So modifying the environment is a big one. You want to look for sounds that might be misinterpreted, right? The television. It might be that your mom always watched a certain show at a certain time, or it's on and they used to like it, But after a certain point, that extra stimuli that's coming in can be disruptive and disorienting. So it might be time to not have the TV on anymore, right? They might confuse what somebody says on the TV as somebody actually being in the room interacting with them. So turning off the TV, air conditioner noise, any outside thing, right? Because that's something as someone develops with Alzheimer's, sometimes their sensory input gets overloaded and their brain doesn't know what to do with all the sensory things coming in. So controlling the environment as much as possible can be very helpful to help keep a person calm and focused, and help their brain process things better as it's coming in and not get so overwhelmed with it. You want to look for lighting. Again, right? Maybe there's a weird shadow. All of us have been in that situation where the shadow's off, and if we're even a little bit jumpy, right, we think we see something out of the corner of our eye. We've all been there, and that's happened with weird shadow and lighting and things, and the curtain being weird or whatever. So it might be something like that. So again, making sure you are meeting your loved one's needs by adapting the environment to how they are going to be the most successful and feel the safest with it, right? And sometimes, honestly, after a certain point, take down or cover mirrors, because someone with dementia or Alzheimer's, after they get to a certain point, sometimes they don't recognize themselves. And so they can actually be upset by seeing themselves in a mirror. To them, that's just an old person. Well, they don't know, because in their head, they might be 17, right? Or they might be 23. And so they are seeing themselves internally, right, as they feel they are, where their mental age is. And so if they look in the mirror, they're going to expect to see 23-year-old them, right? Not 73-year-olds them or 55-year-olds them, right? So sometimes that can help calm and make a less distressing environment for your loved one as well. So those are some tips for you. Again, welcome. I'm glad you're here and you came in for my little chat about how hallucinations might show up and why in folks with dementia and Alzheimer's. Please, if you have any questions or comments, put them in the chat below. If I can be of help with anything, please do not feel hesitate to reach out. You can reach me at Sivan@PurdueArtTherapy.com. Again, I am Sivan Purdue of PurdueArtTherapy.com. I am an art therapist and a creative life engagement consultant. If you have any topics that you want me to discuss dealing with dementia, Alzheimer's, mental health things, art therapy, I am happy to do so. Please just let me know. Again, you can reach me at my email. And I look forward to chatting again. We will be chatting again next Tuesday at 3 o'clock. And that week, we are going to be talking about what is the difference between early onset Alzheimer's dementia and late onset Alzheimer's dementia, and what's the difference in diagnosis and why. All right, take care, stay warm here in Maryland. It's really chilly right now. I've got my giant cup of tea that I'm working on to stay warm. Take care, be safe, and I will see you again soon, hopefully. Bye.